Hi everyone, today I'm walking through some more practice questions for the National Clinical Mental Health Counselor exam. This is going to be in the form of a case study, and then I'm going to have 6 practice questions after. Okay, so here's our info. The client's name is Kayla Henderson. She's a sophomore and identifies as Black and female, and she was referred to us by the school counselor. So here's what we know about our presenting problem. Kayla was referred to counseling after multiple teachers reported a drop in academic performance and frequent absences. She appears withdrawn and often puts her head down in class. During the intake, Kayla shares that she doesn't really care about anything anymore and has been feeling tired all the time. She denies any physical illness. She says she has stopped going to cheer practice and has avoided most of her friends. When asked about her mood, she shrugs and says, "It's whatever, I guess I'm just done trying." Kayla becomes tearful when asked about home life, but doesn't elaborate, saying, "It's complicated." Here's her family and social history. Kayla lives with her mother and 2 younger siblings. Her parents divorced 2 years ago after a highly conflictual relationship. She has limited contact with her father, whom she describes as angry all the time. Her mother works 2 jobs, and Kayla often takes care of her siblings after school. Kayla reports that she used to be very social and active in school clubs, but began withdrawing after a breakup and a falling out with a close friend. She has no prior history of counseling, and she denies substance use. Here's her mental status exam. Her appearance was disheveled, and she had poor eye contact. Mood, depressed. Affect is flat and tearful at times. Thought process is coherent but vague. Thought content is passive hopelessness. Suicidality, she denies active ideation, but admits to thoughts of not wanting to be here. Insight is limited, judgment is intact, and she's oriented to person, place, time, and event. Her initial diagnosis, and this is still provisional, is F32.1, major depressive disorder, moderate. Z63.5, disruption of family by separation or divorce. Z62.820, parent-child relational problem. And we're going to work to rule out persistent depressive disorder or dysthymia. Which areas should be further assessed in the initial sessions? Select all that apply. A, duration and severity of depressive symptoms. B, history of or suicidal behavior. C, current family dynamics and responsibilities. D, onset and impact of her academic decline. E, mother's work schedule and employment history. F, substance use screening. And the answers are almost everything. A, B, C, D, and F. The rationale behind this is that all areas are relevant to the clinical picture. E may provide context, but it's not directly clinically relevant for initial treatment planning. Substance use must be ruled out despite her denial. What would be the most appropriate early treatment focus? And we're going to select only one. A, explore the reasons behind her parents' divorce. B, encourage emotional expression and normalize her experiences. C, refer her to juvenile court services due to truancy. Or D, begin trauma processing related to past parental conflict. And the answer is B, Establishing emotional safety, validation, and rapport is key in early adolescent treatment. Trauma work, which was A and D, may come later. Legal involvement is not warranted. Which standardized assessments would be most appropriate to use at this stage? Select all that apply. A is the PHQ-A, which is the Patient Health Questionnaire adapted for adolescents. B is the Columbia Suicide Severity Rating Scale, the CSSRS. C is the Trauma Symptom Checklist for Children. D is the Vanderbilt ADHD Diagnostic Rating Scale. And E is the Beck Depression Inventory, BAI. The answers are A, B, and C. So the PHQ-A is designed for adolescent depression. The CSSRS assesses suicide risk. The TSCC can screen for trauma if suspected. ADHD or anxiety screeners are not immediately indicated based on the presenting problem. Kayla states, "Sometimes I wish I could disappear, but I won't actually kill myself." What is the best response? Select only one. A, you're going to say, "That's pretty normal for teenagers to feel." B, conduct a formal risk assessment and explore intent and means. C, immediately refer her to inpatient psychiatric treatment. Or D, redirect to focus on more positive coping skills. And the answer is B, passive suicidal ideation must be assessed further. Normalizing it, which was A, or redirecting, which was D, misses the clinical risk. Inpatient treatment, which was C, may not be necessary unless there's a risk. Which of the following interventions would be most appropriate to incorporate into Kayla's treatment plan? Select all that apply. A, behavioral activation to increase re-engagement in school and activities. B, family counseling to address relational dynamics and caregiving burden. C, group therapy with peers who have experienced divorce. D, exposure therapy for social anxiety. And E, assertiveness training to address peer conflict. And the correct answers are A, B, C, and E. These interventions support mood improvement, role clarity, and peer connection. Exposure therapy is not indicated unless social anxiety is diagnosed. Which referrals or supports would be most appropriate for Kayla at this time? And you're going to select all that apply. A is school-based support services, so 504 or an IEP evaluation or mentoring. B, peer-based social skills group. C, academic tutoring or homework help. D, child protective services. Or E, a parent psychoeducation group. And the answers are A, B, C, and E. So academic and emotional support at school, peer connection, and parent education can significantly benefit Kayla. There's no current indication for CPS involvement, which was D. I hope you found this resource helpful. Please hit the like button if you did. If you have any follow-up questions or feedback, please drop it in the comments. Don't forget to subscribe to Becoming a Therapist and share this video with any classmate or friend who might also find this helpful. And I wish you well on your journey towards becoming a therapist.